I think for us in Africa, what would be useful is for us to go all out and use our health worker field operators to reach out and find people with suspicious symptoms, test them early before they are complicated, and then in the process, we could isolate them if they are found to be positive. That I think is going to be very helpful in reducing the numbers of people who will overwhelm our system. We also find that there are many people who are asymptomatic, particularly the younger people, and so it's important for us to always have a sense of the prevalence of the infection in the community. In relation to mortality, I think it's a bit early for us to explain what this would be, but we think that Africa largely has been behind the rest of the world in the onset of the outbreak. This might be a factor, so it might be early days for us. Secondly, we've noticed that some of the people are people who are younger, healthier, and therefore they tend to handle the infection a bit better. On most of the patients who have succumbed have got comorbidities, underlying cardiovascular diseases, pulmonary diseases, renal diseases, HIV and immunocompromised situations due to cancers. We think that this is a major factor, and the most of the people have also been above the age of 60. Particularly, we've seen the experience of what's happening in the world where the larger numbers of mortality comes from those who are from 60 to 70, 70 to 80, 80 and above. So we think that those are some of the issues. I think our preparedness needs to be focusing on creating more triage centers in every hospital, every clinic, so that people who walk into the clinic and hospital who have got symptoms, respiratory symptoms, must be separated from the rest of the patients in the hospital. And secondly, that we create field hospital beds, so that someone who is asymptomatic and does not need treatment but is still infective cannot go back to their communities where they are overcrowded and they cannot be isolated. They must be kept for the 2 weeks until we have the treatment. At the moment, we've got very few people on ICU, about 30 of them, and about 15 are on ventilators. So most of the people who are possible to isolate at home are being treated at home because of the ability to contain the infection from infecting other people. So I think we have to learn as we go, but very strong case management from our clinicians is one of the major issues, and protection of our staff from getting infection.